Alright, let's dive into our first topic, understanding the various influenza strains, their differing symptoms, transmission modes, and potential complications. It's essential to realize that the flu is far more than just a bad cold, and it's a serious illness that shouldn't be taken lightly. Influenza, commonly known as the flu, is a contagious respiratory illness caused by viruses that infect the nose, throat, and sometimes the lungs. There are three main types of influenza viruses, A, B, and C. Influenza A and B viruses are responsible for seasonal flu epidemics each year, while influenza C usually causes mild respiratory symptoms. Influenza A viruses are further classified into subtypes based on two surface proteins, hemagglutinin H and neuraminidase N. There are 18 different H subtypes and 11 different N subtypes, which can combine in various ways, resulting in numerous potential strains. Influenza B viruses are not divided into subtypes, but are instead separated into two lineages, B. yamagata and B. victoria. The symptoms of influenza can vary depending on the strain, but generally they come on suddenly and may include fever, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, and fatigue. Some people may also experience vomiting and diarrhea, particularly in children. The flu is primarily transmitted through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people nearby or be inhaled into the lungs. The virus can also survive on surfaces, so touching a contaminated object and then touching your face can lead to infection. Influenza can lead to severe complications, especially among young children, elderly adults, pregnant women, and individuals with chronic medical conditions, such as asthma, diabetes, or heart disease. Complications can range from sinus and ear infections to more severe conditions, such as pneumonia, inflammation of the heart, brain, or muscles, and even organ failure. So as you can see, the flu is much more than just a bad cold, and it's crucial to be aware of the different strains, symptoms, and transmission modes to protect yourself and others from this potentially severe illness. Moving on to our second topic, let's discuss the importance of the yearly flu shot in protecting yourself and others from the virus, reducing the severity of symptoms, and minimizing potential complications. The flu shot is a vaccine that helps protect against the most prevalent strains of influenza circulating each year. Health experts closely monitor flu activity worldwide and use this information to predict which strains will be most common during the upcoming flu season. The vaccine is then designed to protect against those specific strains. Getting vaccinated is essential for several reasons. First and foremost, the flu shot can significantly reduce your chances of getting infected with the virus. And even if you do catch the flu, the vaccine can help lessen the severity of your symptoms, making it less likely that you'll need to be hospitalized or suffer from severe complications. Moreover, the flu shot plays a vital role in protecting vulnerable populations, such as young children, elderly adults, pregnant women, and individuals with chronic medical conditions. By getting vaccinated, you're not just protecting yourself, but also helping to prevent the spread of the virus to those who may be at higher risk for severe complications. Another crucial aspect of the yearly flu shot is that it contributes to herd immunity. This means that when a significant portion of the population is vaccinated, it becomes more difficult for the virus to spread, ultimately protecting those who cannot be vaccinated or might not respond well to the vaccine due to various reasons. In summary, the yearly flu shot is a critical tool in the fight against influenza. It not only helps protect you and those around you from the virus, but also reduces the severity of symptoms and minimizes potential complications, making it a vital part of maintaining public health. So, don't forget to get your flu shot each year. Now, let's move on to our third topic, the significant impact of influenza on public health. We'll be discussing the high morbidity and mortality rates associated with the virus, particularly in vulnerable populations. Influenza is a significant public health concern worldwide. According to the World Health Organization, seasonal flu epidemics result in 3 to 5 million cases of severe illness and approximately 290,000 to 650,000 deaths globally each year. These numbers highlight the serious consequences of the flu especially for those who are more susceptible to complications. Vulnerable populations, such as young children, elderly adults, pregnant women, and individuals with chronic medical conditions, are at a higher risk of experiencing severe complications from the flu. This can lead to hospitalization, long-term health problems, and even death. For example, during the 2017-2018 flu season, an estimated 48.8 million people in the United States experienced flu illness, resulting in nearly 1 million hospitalizations. The high morbidity and mortality rates associated with influenza place a significant burden on healthcare systems and can strain resources during peak flu seasons. Hospitals and clinics may become overwhelmed with patients, and healthcare providers may struggle to manage the influx of cases. In addition to the direct health consequences, influenza also has substantial economic implications. Illnesses can result in lost productivity, missed work and school days, and increased healthcare costs. In the United States alone, the flu is estimated to cause an annual economic burden of $11.2 billion, considering medical expenses and lost earnings. In conclusion, the significant impact of influenza on public health cannot be overstated. The high morbidity and mortality rates, particularly among vulnerable populations, combined with the strain on healthcare systems and the economic burden, make it essential to prioritize prevention and control measures. Moving forward to our fourth topic, let's explore the role of effective hygiene practices such as hand washing and proper respiratory etiquette in preventing the spread of influenza and other respiratory infections in the community. Maintaining good hygiene practices is essential in reducing the transmission of influenza and other respiratory illnesses. One of the most effective ways to prevent the spread of germs is by regularly washing your hands with soap and water. Make sure to wash your hands for at least 20 seconds, covering all surfaces of your hands, and then rinse thoroughly. If soap and water are unavailable, use an alcohol-based hand sanitizer containing at least 60% alcohol. Another crucial aspect of proper hygiene is respiratory etiquette. This means covering your mouth and nose with a tissue when you cough or sneeze, and then disposing of the tissue in a trash bin. If you don't have a tissue, cough or sneeze into your elbow, not your hands. Tissue, nicely. This helps prevent the spread of respiratory droplets that may contain the flu virus. In addition to hand washing and respiratory etiquette, it's essential to avoid close contact with individuals who are sick and to stay home when you're feeling unwell to prevent the spread of infection. Also, remember to clean and disinfect frequently touched surfaces, such as doorknobs, light switches, and countertops, as the flu virus can survive on surfaces for extended periods. Furthermore, maintaining a healthy lifestyle can boost your immune system and help you fight off infections more effectively. This includes getting enough sleep, staying physically active, eating a balanced diet, and managing stress. In conclusion, effective hygiene practices play a crucial role in preventing the spread of influenza and other respiratory infections in the community. By washing your hands, practicing proper respiratory etiquette, and maintaining a healthy lifestyle, you can significantly reduce your risk of becoming infected or transmitting the virus to others. So, let's all do our part to keep ourselves and our communities healthy. Lastly, let's discuss our fifth topic, becoming familiar with the treatment options available for influenza, including antiviral medications, supportive care, and the importance of early intervention in managing symptoms and reducing complications. If you happen to catch the flu, it's essential to start treatment as soon as possible. Early intervention can help reduce the severity of symptoms, shorten the duration of the illness, and prevent serious complications. One of the primary treatments for influenza is antiviral medications. These medications, such as oseltamivir and zanamivir, work by inhibiting the replication of the virus in the body. They are most effective when taken within 48 hours of the onset of symptoms, so it's crucial to seek medical attention as soon as you suspect you have the flu. Antiviral medications can be especially beneficial for high-risk individuals such as young children, elderly adults, pregnant women, and those with chronic medical conditions. In addition to antiviral medications, supportive care plays a significant role in managing flu symptoms and preventing complications. This includes staying well hydrated by drinking plenty of fluids, getting plenty of rest, using over-the-counter pain relievers and fever reducers like acetaminophen or ibuprofen, and using a humidifier to ease congestion and make breathing. If you're experiencing severe symptoms, such as difficulty breathing, persistent high fever, chest pain, or signs of dehydration, it's crucial to seek immediate medical attention. In summary, when it comes to treating influenza, early intervention with antiviral medications and supportive care is key to managing symptoms and reducing the risk of complications. If you suspect you have the flu, don't hesitate to seek medical advice, and always follow your healthcare provider's recommendations to ensure the most effective treatment and recovery.